Greetings everyone, welcome to today's video, and we are discussing about healthcare practice in Uganda. So basically, Uganda has decentralized healthcare systems whereby health services are delivered within 7 tiers, or call them 7 levels, ranging from the village level, whereby we call it a health center 1, which always comprises of village health teams headed by a village health team member who can be either a health worker or a trained support staff with knowledge concerning identification of illnesses. So at that level, a VHT person will identify a person in the village who is sick, who needs health care, and will refer him to a health center 2, which is always headed by an enrolled nurse. Receive treatment, and if a patient does not heal and needs referral, he will be referred to a health center 3, which is always headed by either a registered nurse or a medical clinic officer. So from health center 3, in case a patient fails to get cured, will be referred to a health center 4, which is always headed by a medical officer at a level of a bachelor's degree in medicine and surgery. And at this level, we normally have an operating theater, normally have inpatient ward, they have outpatient department, and other friendly services like HIV services, antenatal and maternal services, immunization, and other services depending on the funding of the health facility. But however, in failure of management, the patient can be referred from health center 4 to a health center 5, which is always a district hospital headed by a medical officer of a special grade. For example, a consultant specializing in public health or a consultant specializing in general medicine. Failure of the hospital to manage a patient, they refer to a regional referral hospital, which is always at a level of a health center 6. And this is always in divisions of the country. And if, in case, a regional referral hospital, which has different specialties, fails to manage the patient, they will always refer to a national referral hospital. So currently in Uganda, we have approximately 5 national referral hospitals, whereby the first one being, and the oldest being, Mulago National Referral Hospital, and also Butabika National Mental Referral Hospital, and the other national referral hospitals like Mulago Kawempe, which is always part of Mulago Hospital, Chirudu, which is also part of Mulago Hospital, but however, all of them fall under Mulago National Referral Hospital. So in Uganda, health care services are basically managed according to levels, depending on the qualification of the healthcare providers, services provided, funds and support from the government, and also the equipment provided by the government. However, there have been some challenges in health care provision that have been noted. Especially, healthcare service delivery is mainly divided into 2. The public sector, which is always government aided, and the private sector, which is always privately owned. The private sectors, people always pay money. Clients and patients pay their own money to receive health service delivery. And in the public sector, patients receive free government services from the health workers and from the health facilities. However, due to Uganda being a third world country, there are some challenges which have been identified in the public sector. For example, a high patient burden to medical staffs. 2. Low funding of the government facilities due to the national budget of the country being low. So, in this case, the government ends up supplying only essential medicines for health care. So, at times, this makes management of some patients complicated due to lack of medicines. So, patients end up buying medicines from the private pharmacies so they can receive services. Another challenge is distance of the health facilities from the general community. In some cases, you'll find a health facility, for example, a health center for being 20 to 30 kilometers away from some patients. So it will be hard for such a patient to receive treatment or to reach the health facility in time. And hence, a patient may lose his or her own life before receiving the health service delivery. Then three, poor accommodation and at times lack of accommodation for the health workers. This ends up demotivating health workers and also at times leads to the absentia of health workers from the health facilities in times of need. Three, the disease burden. Uganda being in the tropical regions of Africa, we are always burdened to suffer from tropical illnesses or tropical diseases. For example, malaria, which is the leading killer in Uganda, affecting children and people of the low age, less than 18 years. 4. Other financial constraints. For example, a low monthly supply or low monthly funding from the government to the health facilities. This makes it hard to meet other management costs needed by the hospital administrative officials, hence affecting health service deliveries in some health facilities. So, therefore, the above few challenges, amongst other challenges that affect service delivery in some government facilities, there is need to put up support, to put up extra funding in both government facilities to improve quality service delivery for all. However, there is also need of all well-wishers, funders, donors who are interested in quality health to support us in ensuring quality health service delivery. I'm looking forward to registering a non-government organization or an NGO which is healthcare based. So I therefore request for all well-wishers, all funders, all donors to support me towards my aim of making the world a better place through delivering health services, especially to the disadvantaged people who cannot meet costs of the private facilities. I'll be glad if I receive your support. Thank you. God be with you.